This Health in Focus is a paid segment by Jagannathan Neurosurgery.
Everyone is going to deal with pain at some point in their lives, but there are so many different ways to treat it. We are with Amy Tittle. She is an adult nurse practitioner here at Jagannathan Neurosurgery.
Hello.
Talking about different ways to treat pain, because there are a lot of ways to go about this. And where should people start?
Well, we always usually like to recommend non-pharmacologic or natural ways to treat pain initially, and those include things like heat, cold, physical therapy, occupational therapy, exercise and yoga is really great, different types of relaxation techniques, meditation, breathing exercises can be very helpful, and there's a slew of non-pharmacological ways you can treat pain.
And so you can go over the counter, head to your drugstore, and what things should people keep in mind when they're looking for some sort of a pain reliever?
So there's three pretty major categories. The first is Tylenol, which everyone's heard of over the counter. Tylenol or acetaminophen. That's the most common thing people use for pain, muscle aches, headaches, fevers. There is some caution with that. You want to take it as it's directed. You don't want to take more than 4,000 milligrams a day per the FDA. You also want to use caution if you have any kind of liver disease. Anti-inflammatories, also known as NSAIDs, are really common. We know those as Motrin, ibuprofen, naproxen, Aleve. Those are used to treat when you have any kind of inflammation and injury, also muscle aches. But if there's swelling, if there's redness, and a new injury, those can be very helpful. Again, those are also, they have a ceiling limit depending on the medication used, so you should take them as prescribed. You also want to be careful if you have any kind of kidney failure or kidney dysfunction that you use those cautiously, and this seems to affect the elderly more so. And finally, there's topical medications,
creams,
right, that you can buy over the counter, gels, creams, patches even. These come in the form of Bengay or Aspercreme or Salonpas. These are lidocaine based or salicylates or menthol based that kind of help relieve the pain on a topical level.
Okay, so those things don't work. You try, the non-drug approach. You go to the drugstore. You do that. Last line of defense, going to see your doctor, getting a prescription. So where do you go from there?
Yeah, so for prescriptions, in the NSAID category, as I talked about earlier, there is one called Toradol or Cadorlac that can be helpful. That's a prescription. Also, there are lidoderm patches that are a little bit stronger than the over-the-counter that can be quite effective for pain. Additionally, there's muscle relaxants. Those are used to treat pain related to muscle stiffness or muscle injury or even post-operatively. And then we get to opioids, which we always, as providers, want to prescribe judiciously based on recent laws that have passed because of the epidemics that have been going on. These can cause some side effects you want to be very careful with, oversedation, respiratory depression. So we are very judicious in prescribing those.
Absolutely.
Finally, there's some other medications, we call them Adjuvant Therapies, that can be used for pain, prescribed by providers. Adjuvant therapies are not necessarily intended for pain, but they've been shown to be beneficial for pain. These include anxiolytics. Things like Valium, the benzodiazepine family, has some muscle relaxant qualities and have been shown to help pain. Anticonvulsants, these are things like gabapentin and Lyrica that have been very helpful with nerve pain, and also antidepressants.
Amy, thank you so much. So yeah, follow the directions, listen to your doctor.
Right.
Do what you're supposed to do, and hopefully everyone can take care of their pain in the easiest way possible. Thank you so much. If you want more information about Jagannathan Neurosurgery, you can always head to our website, 9in10news.com.
This Health in Focus is a paid segment by Jagannathan Neurosurgery.